Here are 5 things that your labor and delivery nurse wants you to know before you have your baby. Number 1, it's actually encouraged to have a birth plan and to have gone over all the different options for pain management, delivery, and everything that feels right for you and your birth partner and your newborn. Number 2, have someone with you in the birthing room who can advocate for your wants and your desires on your behalf. Because sometimes when you're in a lot of pain, or if you're in a state of health that you can't really communicate for yourself, you won't necessarily get the things that you wanted prior to delivery. So make sure you have an advocate there who is willing to stand up for you and your beliefs. And number 3 is keep the visitors at home. Okay, guys, I know it's so exciting to have all the family and friends at the hospital, but in my opinion, it is so much easier if you just wait until you get home. As the nurses, we are coming in and out and wanting to do breastfeeding help. We are wanting to examine your downstairs area or your incision quite frequently, and I find it very difficult when there's lots of people coming and going for me to do a proper assessment. I also feel like this is a time that you need to focus on yourself and your birth partner and bonding with your newborn. And as exciting as it is, I would say just wait until you get home to have all those visitors. Number 4, if you are low risk and you're not having any concerns, stay home as long as you can. If you think you're in labor, you can always give the hospital a call and go over your signs and symptoms. But honestly, if this is your first baby, most of the time you have a long haul ahead of you of contractions and pain. And I would say it is best if you can stay home as long as you can. Of course, as long as baby's moving, you're not bleeding, and there's no other health or safety concerns. Number 5, you don't get an award for having a baby a certain way. It is okay if you have a scheduled C-section. It is okay if you get an epidural. And it is okay if you have an emergency traumatic delivery. Make sure you talk to us about it, and just know that you don't get a reward for doing it exactly how you thought it would go. It's okay if things change when the time comes. What's most important is that you and your baby are healthy and safe.